So my name's Dr. James Nyirenda. I'm an obstetrician gynecologist based here in Lusaka at Kanyama General Hospital. So I was trained in the Merck Foundation Fertility Program and the Merck Foundation More Than a Woman. And that was in 2021. And the course ran from somewhere August to about November 2021. That's when we completed the training. This training was in India, in Bangalore. It was at Milan Hospital. That's where I did the training. So then the course overall, overview of the course is that it's a well-structured course, and it's a very important course to professionals like myself, that is for a gynecologist and obstetrician. Why I say so is that during our training as obstetrician, we get trained in obstetric in fertility, but it is not as detailed as the training is. So it is a very important course for all obstetricians that they should undergo. And the training itself is very enlightening, and we had a lot of exposure in terms of the mode of training, because the mode of training just not only involved theory from classroom, but also involved exposure with patients and exposure with the faculties doing their procedures, and also had some hands-on experience in terms of how they pick up eggs and other procedures that we had in terms of hands-on. So it's a very well-structured, and the mode of training was very well put up. The course, in addition, has really benefited in terms of in the healthcare system, like here in our hospital at Kanyama General Hospital, in that these patients are couples that previously are couples that would refer to the private hospitals. Most of the couples that will come across with fertility after doing the investigations, most of them ended up just being referred. And also, as we just told them, there's nothing we could do, and they ended up and continue with the problem, without knowing what to do next. But with the training now, we have been able to provide a lot of service to these mothers, and I have, at least from the months that I've been practicing, I have a couple now that is almost 3-4 months pregnant now. From the same resources that we have as a hospital, nothing sophisticated. We use the same resources that we have at the hospital, and the couple is pregnant after having so many trials, been married for more than 5 years, never had a child, and now the couple is pregnant, and we are looking forward to delivering that mother as a first delivery from our new clinic that we've set up for fertility couples. So that is the impact that is having. And with the doctors that I work with as a team, because they're also being information is being shared with them, we are emphasizing that going forward we are likely to see more couples coming back with positive results, and in turn increasing the numbers in terms of benefiting from the service that we are now providing, having had this specialized training in fertility. To streamline, we still have a lot of bottlenecks in terms of providing what we can manage as a hospital. So long-term plan are that we hope that the service that we are providing can improve further in terms of almost all doctors that are managing these patients or coming across these couples that come with fertility will be able to provide the same level of management as someone who was trained in this fertility training program. And also on an individual perspective, I have also plans that will do a further advanced course in embryology, because the fertility training that I did was biased just on so equipping ourselves with some of the basic equipment to provide a comprehensive care to these parents. Referring this course to a colleague, very likely I have seen the impact that this course has had in me as an obstetrician, and I recommend every obstetrician that has been trained that they also get trained in this training in terms of the fertility program, because it has more detailed information and more detailed skills in terms of managing these mothers with fertility, and as opposed to the training that we undergo during the general training for obstetrics. Yeah, so my last comments are, I'm grateful to Merck Foundation for giving me an opportunity to get trained in the fertility program, and also for giving me skills and knowledge in terms of managing these mothers who come with these problems that initially I would end up referring, or initially would just say there is nothing that we could do. But now I have the capacity, and I'm also grateful on behalf of the mothers that we are taking to, because they are now benefiting from the training that I attend. So we are grateful as a doctor and also as a community to Merck Foundation More Than a Woman for the training that they sponsored me.